Welcome to Secure Money Mindset, where seasoned advisors cover the topics that matter most to your financial future. Each episode is packed with practical insight, real conversations, and guidance you can trust. Let's dive in.
Hello, and welcome to this week's episode of the Secure Money Mindset podcast. My name is Nate Borrmann. I'm a financial advisor here at Secure Planning Group. And with me today is Medicare Steve Perlman from mmeau.com, making Medicare easy and understandable. Hey, Steve.
Hey, how you doing, Nate?
I'm doing well. How are you?
Good. Keep busy.
Yeah, awesome. Thanks for being here. So today we wanted to bring you just a little bit about Medicare, and we'll start by hearing a brief history of Medicare.
So I think it's really important for people going on Medicare to understand how we actually got here. So it's 1965. President Johnson signs into law the Medicare and Medicaid Act of 1965, creating two government agencies. One is a health insurance company for seniors. The other one is a financial assistance agency funded by the federal government, but administered by the states. Back in 1965, health insurance looks very different than it has in the last 45 plus years. HMO plans, PPO plans, managed care plans don't even exist. They don't come into existence until the late 1970s. Back then, about a third of Americans were getting their health insurance from union benefit plans. Union membership was at an all-time high. The other two-thirds had something called Blue Cross Blue Shield Major Medical. Blue Cross paid for hospitalization. Blue Shield paid for all of your non-hospital medical. So when they implemented Medicare in 1966, they wanted to mirror that format because most people were already familiar with it. Now the question is, why is the government getting into the health insurance business? Well, back then, major companies that sold major medical plans were allowed to require every single person to go through full medical underwriting to buy a health insurance policy going into retirement. And don't you know, in 1966, 65-year-olds had pre-existing conditions. Consider this. It's 1966, and the first people that are eligible for this new government program are 65 and over, which means most of them were born between 1880 and 1900. And now they're getting health insurance from the government. Harry Truman first proposes Medicare in the early 1950s, that every American should have the right to buy health insurance, whether you spent your life as a coal miner or a corporate executive. What you did contributing to the American economy through your working life should not preclude you from the right to have health insurance going into retirement. So the reason that Medicare is so that every American citizen has the right to buy health insurance going into retirement with no medical questions.
Awesome. That was a really great overview of the history of Medicare. And now I know there's a few different parts to Medicare, A, B, C, maybe there's a song somewhere. Can you tell us a little bit more about the different parts of Medicare?
So again, there are several different parts of Medicare. When Medicare first started, there was Part A and Part B. Again, this was to mirror the Blue Cross Blue Shield model. Medicare Part A. Medicare Part A covers a couple of different aspects of your health insurance. First of all, Medicare Part A, for most people, the overwhelming majority of people, does not have any premium. You've been paying into your Social Security FICA taxes throughout your working career, and as long as you have your 40 quarters, that entitles you to a full Social Security retirement benefit, or you were married to somebody who has their 40 quarters, you get Medicare Part A at no premium. You know, back in the 60s, we had a part of the economy that's been diminishing ever since. Stay-at-home spouses who may never have contributed to their own Social Security account. So they had to write into the law a way for spouses to be able to get Medicare Part A at zero premium. Medicare Part A's primary function is hospitalization. From the time you are admitted to the hospital to the time you're discharged. Every doctor, every test, every surgery, every procedure, every medication, everything that happens during that hospitalization is covered by Medicare Part A 100%. What's not covered is the copayment for going into the hospital. The copayment for going to the hospital this year happens to be $1,736, but one of the reasons you're going to buy a Medicare supplement plan. Medicare supplement, Medigap, secondary insurance, they're all the same product. One of the reasons you're going to buy a Medicare supplement plan is because the Medicare supplement plans that we offer in this area pay that hospital copayment 100%. So between Medicare Part A and your supplement plan, you go into the hospital, what's your out-of-pocket cost? Zero. Now, that's for the first 60 days. After 60 days, there are some co-payments. But the overwhelming majority, 99% of all hospital stays for people who are Medicare eligible, last inside of that 60-day window. Medicare Part A also covers hospice care. Sometimes as things are winding down, people need help keeping themselves comfortable in their waning days. Providers that provide hospice care know that if the patient has Medicare A, there's no billing to the patient, there's no billing to the patient's family after the fact. Medicare Part A also covers going to skilled nursing care after a medical event. So let's unwrap that one a little bit. So we've had this wonderful winter going on here, and maybe somebody took a slip and fall on some of that ice that was outside, and they broke their hip, and they broke their pelvis, and they ended up in the emergency room. And now they're in traction. They can't even transfer out of bed. They've got to go to rehab. Medicare will contribute towards that rehab event, but here's what has to happen. You have to be admitted to the hospital for at least 3 consecutive days. Then within 5 days, you go to the rehab. Typically, that happens in the same day. Medicare is going to cover the first 20 days 100%. In days 21 through day 100, you're going to have a $200, $225 a day copayment for that care. Average stay is about 4 to 6 weeks. Medicare covering 20 days, in most cases, is almost half the stay. So Medicare Part A's primary function is hospitalization. Secondarily, it covers hospice care and skilled nursing care.
Okay. That's a really great summary of Part A, Steve. Let's dig into Part B now.
So Part B. So when you go on Medicare Part B, you're either going to go on at 65 or over 65, right? Some people do not have to go on Medicare at age 65 because they're getting their insurance from a qualified plan from an employer, whether it's theirs or their spouse's. So when you go on Part B, that's when Medicare is going to become your insurance. You're not actually on Medicare until you have your Part B effective date. Medicare Part B covers all of your non-hospital medical with a few minor exceptions. Medicare Part B does not cover dental, vision, and hearing. Now, that being said, there are several companies out there that do standalone dental, vision, and hearing plans to supplement that, but Medicare has never covered dental, vision, and hearing. Medicare Part B does cover going to your primary, going to your specialist, going to the emergency room, the ambulance ride to the emergency room. It's going to cover all of your outpatient diagnostics. It's going to cover everything from your x-rays to your CAT scans, to your MRIs, to your PET scans, to your blood work, to your stress tests, everything from your endoscopies to your colonoscopies to your DEXA scans. It's going to cover occupational therapy. It's going to cover physical therapy. It's going to cover acupuncture. It's going to cover chiropractic. It's going to cover all of your non-hospital medical. It's going to cover a lot. It's going to cover all of your non-hospital medical. It's not going to cover anything that is done for cosmetic or on an elective basis. So Medicare Part A has no premium. It's going to cover primarily hospitalization. When you go on Medicare Part B, that's when Medicare is going to become your insurance. And Medicare Part B covers all of your non-hospital medical with those couple of minor exceptions. Medicare Part B is when you have a premium. Medicare Part B's current monthly premium is $202.90 a month. Now, we've had something that's occurred in the last several years that never occurred in the history of Medicare, and that is people are going on Medicare at age 65 because they have to, but they're not collecting their Social Security until sometime later, in many cases today, age 67, till they hit their full retirement age. It used to be when you went on Part B, you would naturally start your Social Security because they would deduct your premium from your Social Security check. Now, if you have to go on Medicare at age 65 because you're on an individual plan or you're on a small group plan and you are required to go on Medicare, what happens if you're not collecting your Social Security? They're going to send you a bill. Good old-fashioned 8.5 by 11 piece of paper, right, on a quarterly basis. So $202.90 times 3 is $608.70. The easiest way to pay for that is you're going to set up a Medicare.gov account. You're going to tie it to your checking account. They're going to draft that $202.90 or whatever the premium is in the future directly from your checking account. Once you start to collect your Social Security, it'll naturally transition over to becoming a Social Security deduction.
All right.
Medicare Part B is an 80-20 coinsurance plan. What does that mean? Medicare Part B is always going to cover 80% of your charges with no deductible. So you go on Medicare for the first of the month. Several weeks later, you go to the doctor for the first time. We'll say the doctor was reimbursed $500 for that meeting. Medicare is going to cover 80% of that, which is $400. Now there's $100 left over. You're financially responsible for that $100 because it's an 80-20 coinsurance plan. The main reason you're buying that Medicare supplement plan is to pay the other 20% that Medicare Part B doesn't cover. But because there is a deductible before the supplement plan kicks in, you have to pay that $100. The deductible for this year is $283 for the whole year.
Wow.
Not so bad.
No, it's not bad at all.
So in this scenario, the doctor was reimbursed $500. Medicare paid $400. You paid the other $100 to reduce your deductible. Once you satisfy that deductible between Part B and your supplement plan, you have no cost for your medical for the balance of the year. And that's Medicare Part A and Part B in a nutshell.
Yeah. So you did mention that the premium is $202.90. Is that correct? Does that apply to everybody?
So everybody pays the base $202.90. Now, some people are going to sit back and say, I heard that this is tested against your income, and that is true. So what they have written into the law is that if you are what they are considered a higher income earner in retirement, and this only pertains to about 10% of people on Medicare. So for this year, if you are a couple married filing jointly and your income 2 years ago, everything's done on a 2-year lag. So for 2026, they're looking at your 2024 taxes. If you filed jointly and your adjusted gross income is over $212,000, you're going to start to experience some monthly surcharges. Okay. If you're an individual, it's if you filed individually, it's $106,000. But just know that this is means tested every year on a 2-year lag. And if as a result of going on Medicare that you are retiring and that your income is going down right now, rather than waiting 2 years for the tax filings to catch up, there's actually a form you could file to reduce those surcharges right from the get-go.
Yeah.
So everybody pays the same base $202.90, but some people will have surcharges based upon income in previous years.
Okay. And that's why it's really important when people who are in that 65 plus range, when you're looking at things like Roth conversions and money you're pulling out of your IRAs, it's just important to, think about these things and how, they could potentially impact your Medicare payments. So you've covered parts A and B. What about Medicare supplement plans?
So Medicare supplement plans. So the first thing you need to know about Medicare supplement plans is that they are nationally standardized. So what a Plan G or a Plan N does in Pennsylvania, it does in New Jersey, it does in Florida, it does in California. All those plans are nationally standardized. So they do the same thing in the same way. In most cases today, and in most states today, there's really only 2 plans to choose from. There's a Plan G and a Plan N. Plan G is the plan that I referenced before where I said you pay your annual deductible. The plan kicks in and you have no other charges for the rest of the year for your health care. For most of my clients, and in many, many cases, I always recommend the Plan N as in Nancy. Because depending on where you live and what age you're going on Medicare, you could be saving somewhere between $600 and $800 a year going with the Plan N, but you now pick up a $20 copayment for a doctor's visit, $50 if you go to the emergency room or urgent care. But if you're saving $600 a year in premium, you'd have to go to the doctor 30 times a year.
That's old.
And a lot of people I meet aren't going to the doctor 30 times a year. So if you're looking to keep more of your healthcare premium dollars in your pocket, my recommendation is that you seriously consider a Plan N over a Plan G. Again, either plan, you're going to have to pay that $283 annual deductible.
Yeah.
But again, and there are some other considerations with Plan N, but they're very, very insignificant in the bigger scheme of things.
Okay. And how about Medigap plans? Are those the same thing as Medicare supplement plans, or what are those?
So correct. So Medicare supplement, Medigap, secondary insurance. We've all learned our vernacular from different sources over the years.
Okay.
So again, a Medicare supplement plan, a Medigap plan, secondary insurance, my Medicare secondary insurance, It's all the same product.
Great. So now that we've covered parts A, B, supplement plans, we're going to skip the letter C and we're going to go right to D. I'll throw out in D, Steve.
So implemented Passed into law in 2005 and implemented in 2006, Congress came out with Part D drug plans. So depending on where you live, there's somewhere in the area of 10 to 14 Part D drug plans available. And there's going to be one that's going to be best for you. Now, these plans are designed, they're all in the same way, but they don't cover your medications all in the same way. So when a carrier is designing a Part D drug plan, what they do is they look at the entire universe of Medicare-approved medications. Just because something is FDA approved doesn't mean that it's Medicare approved. So they look at the entire universe of Medicare-approved medications, and they say, these are the medications that we've negotiated with the pharmaceutical manufacturers with, and these are the ones that we're going to cover. That list of medications is then put into a tier system. Tier 1 is preferred generics. Tier 2 are non-preferred generics. Tier 3 are preferred brands. Tier 4 are non-preferred brands. Tier 5 is specialty medications. Typically, your Tier 1, Tier 2 generics are somewhere between $0 and $5 a month. It's when you get into your branded and specialty medications that there is a very involved cost-sharing model that you have to be aware of for those medications. But I'll just say this. Back in 2022, Congress passed the most significant piece of legislation for people on Medicare in 2 decades. It was put inside the Inflation Reduction Act, signed into law, and what that did is in 2023, it capped the cost of insulin, a life-saving drug that's been around for decades. It capped the cost of insulin at $35 a month, no matter how many units that you use. In 2024, it did away with something that people have heard about their whole life but are not hearing about any longer, called the donut hole.
Okay.
The donut hole was in that cost-sharing model, a level of repricing where a greater amount of the cost of your medications was kicked back onto you. That no longer exists.
Okay.
In 2025, what they did is they capped the cost of your medications. As long as all of your medications are on your plan formulary, in 2025, your medications were capped at $2,000 a year. Okay. I literally had seen clients who were on very expensive outpatient chemotherapies and biologics. When I say expensive, I'm saying their medications cost $35,000, $40,000, $45,000, $50,000 a month.
Man, that's a month.
A month.
Man.
And even though they had a plan, they had that 5% copay, they had no cap. I knew people who were literally spending $16,000, $17,000, $19,000 a year for their life-saving medications. Because of the change in the law, those people are now paying under $3,500 a year, okay, for their medications. So it was the most meaningful piece of legislation for people on Medicare since Part D drug plans were put in place in 2006. For 2026, that cap moved from $2,000 to $2,100.
Yeah.
But again, you don't shop for a plan because it has the lowest premium. You don't shop for a plan because it has the lowest deductible. You shop for a plan because your medications are on the formulary. The cost of the plan, the monthly premium, plus the cost of your medications at your favorite pharmacy or through mail order is less expensive than every other plan. You might be recommended to a plan that is $50 a month. And you're saying, but there's a plan over here that's $6 a month. Why can't I get that plan? Yep. Well, the $6 a month plan charges more for your medications.
Yeah.
So you have to look at your Part D drug card on a total cost basis, not simply premium, not simply deductible, but what is the lowest total cost plan that's available to me in my area?
Yeah, and that's a really great segue into the next part of Medicare, which is Medicare Advantage. Because a lot of people, some people live by the motto, if it's free, it's for me. But there might be some caveats here. What's Medicare Advantage, Steve?
Whew, boy, you really nailed that on the head. So Medicare Advantage plans. This is probably the most important thing that I could say in this entire segment. A Medicare Advantage plan is a private health insurance plan sold by a private health insurance carrier to someone who is Medicare eligible, and it kicks you off of Medicare. I'm going to say it again. A Medicare Advantage plan, Medicare Advantage plan is a private health insurance plan sold by a private health insurance carrier to somebody who's Medicare eligible, and it kicks you off of Medicare. When you're on Medicare, your doctors and providers are billing Medicare. Medicare is responsible for reimbursing your providers. If you disenroll from that system and go to a Medicare Advantage plan, you're now going back to a private health insurance plan that is run by a private for-profit health insurance company. Your doctors are going to bill that insurance carrier. That insurance carrier is responsible for reimbursing your doctors. Now, you hit it right on the head. These Medicare Advantage plans are marketed really aggressively. And as you say, there are a lot of people out there who say, if it's free, it's for me. Well, the first thing I'm going to tell you is there is no free. So these Medicare Advantage plans do start as low as $0 a month. But $0 a month is not $0 a month, because whether you're on original Medicare, A, B, a supplement, and a drug card, or you disenroll from that system and go to a Medicare Advantage plan, either way, you're paying the $202.90.
Yeah.
So there's no escaping the $202.90.
Okay.
So free is not always free. Now, I'm not here to say that Medicare Advantage plans are a bad thing. In our agency, we do sell Medicare Advantage plans. We primarily sell Medicare supplement plans and drug cards, but we do sell Medicare Advantage plans, right? There is a fit for it, but you have to be aware of some of the really big differences between Medicare and Medicare Advantage. First of all Medicare Advantage plans are going to come in the standard 2 flavors of HMOs and PPOs, something like your employer-based health insurance. And what does that mean? That means there's a network somewhere that you have to be conscious of when selecting a provider. Is my provider in network? Is my provider out of network? Original Medicare has no network. It is the most widely accepted health insurance program we have in the country. Second big difference. Original Medicare doesn't charge for hospitalization. Between Medicare Part A and your supplement plan, the overwhelming majority of hospitalizations are going to be covered. Almost every single Medicare Advantage plan is going to charge for hospitalization. It may be a per day, it might be a per stay, and quite honestly, if you have a PPO Medicare Advantage plan and you need to receive care in an out-of-network hospital, your copayment could be as much as 50% of the bill, up to $13,000 a year.
It's a lot of money.
It's a lot of money. Here's the third one, and this is the one that clients have told me is the most important. Original Medicare has no prior authorization process. All Medicare Advantage plans will use prior authorizations as a way to limit what they want to pay for your care. It's really funny. I have a client of mine. She came on about 1.5 years ago, and she called me up in the middle of open enrollment. Now, I know she's single in her later years, and when my clients call me, customer service is always first.
Of course.
So she said, "Can I tell you a brief story?"
This doesn't feel like it's going to be brief stories to you.
It's always a brief story. She said to me, "I've got a lot going on." Now, we don't ever see anybody's chart, but we do see their list of medications. When you've done this long enough, you realize when somebody's dealing with some significant medical issues, of course. She said to me, "My doctor wanted me to go for this MRI that goes from like the top of my head down to the middle of my thigh." Obviously, they're looking to see if whatever she has is spread, I guess. So I said to my doctor, "Who should I go to for this MRI?" And he said, "Well, you're on Medicare now with a supplement plan. Most every, provider that does, imaging takes original Medicare. Call one that's convenient for you and see if they can do this procedure." So she said, "I called the one that I pass all the time going to the grocery store."
Yeah.
And I said, "My doctor wants me to get this MRI," and they gave him the billing code.
Yep.
And they said, "Yeah, we can do that. Who's your insurance with?" And I said, "Well, I'm on Medicare." And I gave him my Medicare number. And then they asked me for my supplement plan, and I gave him my supplement plan number. And then they said, "Okay, we have these dates available. When would you like to come in?" And I picked one of the dates. Voice on the phone says, "Okay, we're going to send you an email to do your pre-admission work. Before you get here, please show up 15 minutes before your appointment. And we'll see you on whatever date that I had chosen."
Yeah.
And they hung up the phone.
Yeah.
So I'm on the phone listening to this conversation, and I said, "Okay." And she says, "No, you don't understand. This is not the first time that I'm having this MRI. I've been dealing with this for a long time. This is the first time I haven't spent 2 months on the phone fighting with my insurance company to get the authorization for the MRI that my doctor says he needs to make sure that I can stay alive."
Wow, that's awesome.
This is amazing. You need to tell my story, and I do every single time.
Yeah, no, that's really amazing. And some people might have already signed up for these Medicare Advantage plans, or they might be wondering, when do I even sign up for Medicare? When are they able to unlock great benefits like that? What if they've already signed up for Medicare Advantage and they don't want to be on that anymore? Like, who's signing up and when are they signing up?
So, Harry Truman's vision of everybody getting health insurance with no medical underwriting is a one-time right. And that one-time right occurs when you go on Medicare Part B. When you sign up for Medicare Part B, they won't ask you any medical questions. When your Part B date is kicking in, they won't ask you any medical questions for your supplement plan or your drug card. Once you've been on Medicare Part B for 6 months or longer, if you want to change your supplement plan, you can, but you have to answer medical questions.
Yep.
Okay? You can always go from Medicare to a Medicare Advantage plan. You only have to wait for one thing. As I jokingly say, football season. But no, it's open enrollment. It is October 15th to December 7th. I say to people, just call me back during football season. We'll be ready to go.
Everyone will remember that.
October 15th to December 7th. So October 15th to December 7th, every year is open enrollment. What does open enrollment mean? Literally means you can make choices with regards to your health insurance coverage with no medical questions. So that's what open enrollment literally means.
Yep.
So if you're on original Medicare, A, B, a supplement, a drug card, and you want to go to a Medicare Advantage plan, all you have to do is wait for October 15th to December 7th. You can choose an Advantage plan. That Advantage plan will become effective on January 1st. No medical questions. If you're on an Advantage plan, you can wait till open enrollment. If you want to change your plan, you select a new plan. That new plan becomes effective on January 1st. No medical questions.
Okay.
If you've been on a Medicare Advantage plan for 1 year or longer, if you go on a Medicare Advantage plan, that first 12 months, they consider that a trial period.
Okay.
And if you haven't been on Medicare before, a supplement plan before, or if you were with a supplement plan carrier, they have to take you back with no medical questions. If you're on a Medicare Advantage plan for 1 year or longer, and you want to go back to original Medicare, Medicare A and B will take you back.
Yep.
During open enrollment, you can buy a Part B drug plan, but you're going to have to medically qualify to buy a supplement plan.
Yeah.
And quite honestly, you don't have to be that sick to be disqualified for a supplement plan. I recently had somebody contact me who was on 2 medications for their blood pressure. They're on a medication called valsartan. And then the doctor had them on a medication called amlodipine.
Okay.
When the doctor put him on a third medication called hydrochlorothiazide, that person's now taking 3 medications for one medical condition, no longer qualified to buy a supplement plan.
Okay.
So it's not that difficult to find an instance where, you can get disqualified. So it's really important to understand that there are 2 completely different systems for providing health insurance to people over 65. One is called Original Medicare. The other one's called the Medicare Advantage Plan, and they do not work together.
Yeah. Well, again, I want to thank Medicare Steve for joining us today. Again, I'm Nate Borrmann with Secure Planning Group. I want to thank you again for listening to this week's episode of the Secure Money Mindset, and we will see you soon.
We hope you enjoyed today's episode of Secure Money Mindset. For more, search Secure Money Mindset on Spotify or wherever you listen to your podcasts, and watch full episodes on YouTube. Thanks for listening to Secure Money Mindset, where financial security is a state of mind.